Certainly. Here are 8 USMLE-style questions focused on catalase-positive organisms, incorporating the mnemonic notoriously big bubbling hassle, nocardia, Burkholderia cepacia, Bordetella pertussis, Helicobacter pylori, Aspergillus, Staphylococci, Serratia, Listeria, Escherichia coli. Each question includes the correct answer, explanations, and rationales for incorrect options. Question 1. A 5-year-old boy presents with recurrent skin abscesses and pneumonia. Laboratory studies reveal a defect in NADPH oxidase activity. Which of the following organisms is he most susceptible to? A. Streptococcus pyogenes, B. Escherichia coli, C. Streptococcus pneumoniae, D. Enterococcus faecalis, E. Clostridium perfringens. Correct answer B. Escherichia coli. Patients with chronic granulomatous disease, CGD, have impaired oxidative bursts due to NADPH oxidase deficiency, making them susceptible to catalase-positive organisms like E. coli. Why not others? A, C, D, E. These are catalase-negative organisms. Patients with CGD can typically handle infections caused by these bacteria. Question 2. A 60-year-old diabetic patient develops a black necrotic lesion on the palate and facial swelling. Biopsy reveals septate hyphae branching at acute angles. Which catalase-positive organism is most likely responsible? A. Mucor species, B. Aspergillus fumigatus, C. Candida albicans, D. Rhizopus species. E. Cryptococcus neoformans, B. Aspergillus fumigatus. Explanation: Aspergillus fumigatus is a catalase-positive fungus that can cause invasive sinus infections in immunocompromised individuals, such as diabetics. Why not others? AD. Mucor and Rhizopus are also associated with similar infections, but are typically catalase negative. CE. These fungi have different morphological features and infection patterns. Question 3. A 35-year-old man presents with a chronic cough and weight loss. Sputum culture grows a weakly acid-fast, branching, catalase-positive organism. Which is the most likely pathogen? A. Mycobacterium tuberculosis, B. Nocardia asteroides, C. Actinomyces israeli, D. Streptomyces species E. Corynebacterium diphtheriae. Correct answer, B. Nocardia asteroides. Explanation: Nocardia asteroides is a catalase-positive, weakly acid-fast bacterium that causes pulmonary infections, especially in immunocompromised hosts. Why not others? A. Strongly acid-fast but not branching. C. Anaerobic and not acid-fast. D. E. Different morphological and staining characteristics. Question 4. A 28-year-old woman presents with peptic ulcer disease. A urease and catalase-positive spiral-shaped bacterium is identified. Which organism is most likely responsible? A. Campylobacter jejuni, B. Helicobacter pylori, C. Vibrio cholera, D. Escherichia coli. Salmonella typhi. Correct answer B. Explanation: H. pylori is a catalase and urease-positive bacterium associated with gastritis and peptic ulcers. Why not others? A. Microaerophilic and urease negative. CE do not have the same enzymatic profile or association with peptic ulcers. Question 5. A 70-year-old hospitalized patient develops pneumonia. The causative agent is a catalase-positive, oxidase-positive, non-lactose fermenting gram-negative rod. Which organism is most likely? A. Klebsiella pneumonia, B. Escherichia coli, C. Pseudomonas aeruginosa, D. Haemophilus influenza, E. Legionella pneumophila. Correct answer, Pseudomonas aeruginosa. Explanation: P. aeruginosa is a catalase-positive, oxidase-positive, non-lactose fermenting gram-negative rod known for causing hospital-acquired infections. Why not others? A. B. Lactose fermenters. D. E. Different growth requirements and staining characteristics. Question 6. A 25-year-old woman presents with a urinary tract infection. The causative agent is a catalase-positive, coagulase-negative gram-positive cocci. Which organism is most likely? A. Staphylococcus aureus, B. Staphylococcus saprophyticus, C. Streptococcus agalactiae, D. Enterococcus faecalis, E. Streptococcus pyogenes. Correct answer B. Staphylococcus saprophyticus. Explanation: S. saprophyticus is a catalase-positive, coagulase-negative, gram-positive cocci commonly causing UTIs in young women. Why not others? A. Coagulase-positive, CE, catalase-negative organisms. Question 7. A 40-year-old man with cystic fibrosis develops a pulmonary infection. The sputum culture grows a catalase-positive, gram-negative bacillus known for its resistance to multiple antibiotics. Which organism is most likely? A. Haemophilus influenza, B. Burkholderia cepacia, C. Escherichia coli, D. Klebsiella pneumonia. E. Pseudomonas aeruginosa. Correct answer, B. Burkholderia cepacia. Explanation. B. cepacia is a catalase-positive, gram-negative bacillus associated with pulmonary infections in cystic fibrosis patients. Why not others? A. Less commonly associated with CF. CE. Different antibiotic resistance profiles and associations. Question 8. A 3-year-old child presents with multiple infections and is diagnosed with chronic granulomatous disease. Which of the following organisms is catalase positive and poses a significant risk to this patient? A. Streptococcus pneumoniae. B. Listeria monocytogenes C. Streptococcus pyogenes. D. Enterococcus fecalis. E. Clostridium difficile. B. Listeria monocytogenes. Explanation. L. monocytogenes is a catalase-positive intracellular pathogen posing a risk to CGD patients. Why not others? A. CE. Catalase-negative organisms. Mnemonic recap. Notoriously big bubbling hassle to recall catalase-positive organisms. N. Nocardia. B. Burkholderia cepacia. B. Orditella pertussis. Helicobacter pylori. Aspergillus, Staphylococci. Serratia. L. Listeria. Escherichia coli.